there's a lot of things that people think are normal about urinary incontinence. They think it's a normal part of aging. They think that there's nothing they can do about it. They think that it's just something that older women experience, but it can happen throughout any woman's lifetime. At Corning, I treat women's health, women's urinary incontinence. There's different types. There's overactive bladder, there's stress urinary incontinence, and there's urge incontinence. The pelvic floor consists of a group of muscles that control your posture, that control your lower back, your hips, your pelvis. They control any kind of bowel or bladder function. So they're a group of muscles, and so that's why physical therapy can treat those and help with symptoms. So usually, if you're having any of those symptoms, you could talk to your doctor, nurse practitioner, OBGYN, describe what kind of symptoms you're having, and they would refer you to physical therapy. On the first day, you would come in, and it's mostly an interview, just talking to you about your symptoms and how it affects your quality of life, and what kind of things you're having trouble with. Based on that, we do some assessment skills. We look at your posture, we look at your strength, your range of motion. Because your pelvic floor muscles are inside your body, we do a short, brief internal assessment. It's not like a gynecological exam, but we're just trying to find if you know where those muscles are. They're called Kegels, and sometimes people do them incorrectly. So we want to make sure that you're doing them correctly, you know where those muscles are. We'll see how strong they are. Sometimes there's some trigger points, some tender areas that need to get stretched. And so that's something that we can do here. And then we will put together a plan of what kind of things that we can do. And most of it's home exercises. Some of it's coming into therapy for scheduled appointments. So that's kind of, usually it's 4 to 8 visits over a couple of months. And a lot of it's teaching and dispelling myths and teaching you how to manage your symptoms yourself.